Close your eyes for a moment and imagine this. You're sitting down, you stand up, and suddenly your legs feel heavy, cold, or numb. Maybe your calves cramp at night or your feet swell by evening. Millions of people over 70 think this is just old age. But what if a surgeon told you that one simple, safe exercise done at home, even while seated, could dramatically improve leg circulation, reduce swelling, and help you feel steadier on your feet again? Stay with me, because this may change how you think about your legs forever. As a surgeon, one of the most common problems I see in adults over 70 is poor leg circulation. It doesn't always start with pain. Often, it begins quietly. Cold feet, tingling toes, shiny skin on the legs, socks leaving deep marks around the ankles. Many people ignore these signs because they're subtle. But inside the body, blood is having a harder time traveling back up from the legs to the heart. Here's why this matters. Your legs are far away from your heart, and gravity is working against you. To push blood upward, your body relies heavily on the muscles of your calves. In fact, doctors often call the calf muscles the second heart. Every time you walk, stand, or push through the balls of your feet, those calf muscles squeeze your veins and help pump blood upward. When those muscles weaken or stop activating regularly, as often happens with age, sitting too much, or fear of falling, circulation slows down. After 70, muscle mass naturally declines. Balance may feel less secure, so people walk less. Many spend more time sitting. Over time, the calf muscles stop doing their job effectively. Blood begins to pool in the lower legs. Fluid leaks into surrounding tissues. That's when swelling, stiffness, heaviness, and even skin changes appear. Poor circulation is not just uncomfortable. It increases the risk of varicose veins, slow-healing wounds, skin infections, and in severe cases, dangerous blood clots. It can also worsen fatigue and make walking feel exhausting, even for short distances. Now, here's the good news. You do not need intense workouts, you do not need a gym, and you do not need to walk miles a day if that feels unsafe. What you need is to consistently activate the calf muscle pump in a safe, controlled way. The one exercise I recommend most to my older patients is something deceptively simple: the controlled calf raise, also known as ankle pumping or heel raises. This single movement directly targets the most important muscle group for leg circulation. Let me explain why this works so well. When you lift your heels and press the balls of your feet into the floor, the calf muscles contract. That contraction squeezes the deep veins inside the lower leg. These veins have one-way valves that push blood upward toward the heart. When you slowly lower your heels, the muscles relax, and the veins refill with fresh blood. Repeating this motion acts like a powerful pump. Studies have shown that regular ankle and calf pumping can significantly improve venous blood flow, reduce leg swelling, and decrease feelings of heaviness in older adults. It's even used in hospitals to prevent blood clots in patients who cannot walk. What makes this exercise especially powerful after 70 is its adaptability. You can do it standing while holding onto a chair or counter. You can do it seated if balance is an issue. You can even do it in bed before getting up in the morning. But here's the key most people miss. Speed matters. This is not about bouncing up and down quickly. Slow, controlled movement creates better muscle engagement and better blood flow. Think of it as gently squeezing toothpaste upward through a tube. In my practice, I've seen people in their late 70s and 80s experience warmer feet within days. Swelling around the ankles begins to reduce within weeks. Night cramps become less frequent. And perhaps most importantly, confidence improves. When blood flow improves, the legs feel more alive, more responsive, and more stable. Another important benefit is nerve health. Poor circulation can starve nerves of oxygen, contributing to numbness and tingling. Improving blood flow helps nourish those nerves, which may reduce these sensations over time. Now, I want to be very clear. This exercise is not a cure-all, and it does not replace medical care if you have severe circulation disease. But for the vast majority of seniors with mild to moderate circulation issues, this is one of the safest and most effective daily habits you can build. In the next part, I'll walk you step by step through exactly how to do this exercise correctly, safely, and effectively after 70, whether you're standing, seated, or dealing with knee, hip, or balance concerns. I'll also explain how many repetitions actually work best, and the biggest mistakes that quietly cancel out the benefits. Now let us slow everything down and walk through exactly how to do this exercise the right way, because the details matter more than people realize. I've seen many seniors try heel raises, but small mistakes can reduce the circulation benefit or even cause discomfort. When done correctly, this movement should feel smooth, controlled, and safe. First, let's talk about the safest starting position. If your balance is not what it used to be, begin seated. Sit in a sturdy chair with your feet flat on the floor, about hip widths apart. Make sure your knees are bent at a comfortable angle and your back is supported. This position removes fall risk completely while still activating the calf muscle pump. From here, slowly lift both heels off the floor while keeping the balls of your feet and toes down. You should feel a gentle tightening in the calves. Hold this lifted position for about 2 seconds. Then slowly lower your heels back down until they fully touch the floor. That slow lowering is just as important as the lift. This entire movement should take about 4 to 5 seconds. Breathing matters too. Many people hold their breath without realizing it. Instead, breathe out gently as you lift your heels, and breathe in as you lower them. This helps relax your body and supports healthy blood flow. If you feel comfortable and stable, you can progress to standing. Stand behind a chair or at a kitchen counter and lightly hold it for support. Your hands are there for balance, not to pull yourself up. Place your feet hip-width apart. Slowly lift your heels, rising onto the balls of your feet. Keep your knees straight but not locked. Imagine growing taller rather than pushing upward. Again, hold for 2 seconds at the top, then slowly lower your heels back to the floor. The slower you move, the more effectively your calf muscles squeeze the veins and push blood upward. Now, how many repetitions actually help circulation? This is where many people overdo it or underdo it. For circulation, quality matters more than quantity. I typically recommend starting with 10 repetitions. Done slowly, rest for about 30 seconds. Then do another set of 10. For most people, over 70, 2 to 3 sets is ideal. As your legs adapt, you may increase to 15 or even 20 repetitions per set, but only if the movement remains controlled and comfortable. You should feel warmth and mild muscle fatigue, not sharp pain, burning, or cramping. One of the biggest mistakes I see is rushing. Fast bouncing movements use momentum instead of muscle. That reduces the pumping effect and can strain the Achilles tendon. Another common mistake is not lifting high enough. You don't need to rise as high as possible, but your heels should clearly leave the floor. Let's also talk about timing. The best times to do this exercise are when circulation naturally slows. Morning is excellent, especially before standing up for the day. This helps push pooled blood back toward the heart and reduces morning stiffness. Another ideal time is in the evening, when swelling tends to be worse. Doing calf raises before dinner or before bed can reduce nighttime cramps and ankle swelling. You can also break this into short sessions. 2 sets in the morning and 2 in the evening can be more effective than 1 long session. Consistency is far more important than intensity. If you have knee arthritis, this exercise is usually very well tolerated because the knee joint barely moves. If you have hip discomfort, the seated version is especially gentle. If you have balance concerns, never hesitate to stay seated or hold on to support. Now, a quick but important safety note. If you experience sudden sharp calf pain, significant one-sided swelling, redness, or warmth in one leg, stop and seek medical care. These can be signs of a blood clot, and exercise should not continue until evaluated. For routine stiffness, mild swelling, or heaviness, this exercise is generally very safe. One powerful variation for circulation is alternating heel raises. Instead of lifting both heels at once, lift one heel while the other stays down, then switch. This mimics walking and can feel more natural for some people. It also challenges coordination in a gentle way. Another helpful tip is footwear. Doing this exercise barefoot or in flat, supportive shoes allows better muscle activation. Avoid thick soft slippers that reduce feedback from the floor. What many people don't realize is that this simple movement also sends signals to your nervous system. It improves awareness of your feet and ankles, which plays a major role in balance. Better circulation, better nerve input, and stronger calves together reduce fall risk. Now let's talk about what happens when you turn this simple exercise into a daily habit, because this is where real change occurs. Most people want to know 2 things. How often should I do this? And how soon will I feel a difference? The answers are encouraging, especially after 70. For circulation benefits, this exercise works best when done daily. Blood flow responds quickly to muscle activation, but it also slows again if the muscles are inactive for long periods. Think of this exercise like brushing your teeth. Doing it once in a while doesn't help much, but doing it every day protects you over time. Ideally, aim for 2 sessions per day, 1 in the morning and 1 later in the day or evening. Each session can be as short as 5 minutes. That's enough time to wake up the calf muscle pump and keep blood moving. Within the first few days, many people notice subtle changes. Feet may feel warmer. That cold, heavy sensation in the lower legs may ease slightly. Shoes may feel less tight by the end of the day. These early signs mean blood is moving more effectively. After 2 to 3 weeks, swelling around the ankles often reduces. Sock marks may become less deep. Skin may feel less tight and dry. Nighttime leg cramps may occur less frequently because better circulation helps muscles relax and recover. By 6 to 8 weeks, calf strength improves noticeably. Walking feels easier. Standing up from a chair feels more stable. Some people report better balance and less fear of falling. This is not just from stronger muscles, but from improved communication between muscles, nerves, and the brain. Now, let's place this exercise into a realistic daily routine. You don't need to change your entire lifestyle. Small additions matter most. Do your heel raises while brushing your teeth at the sink. Do them seated while watching the news. Do them in bed before getting up. The goal is to make them automatic. It's also important to understand what this exercise works best with. Hydration is a big one. Blood that is thick from dehydration moves more slowly. Drinking enough water throughout the day supports circulation. You don't need to overdo it, just steady intake, unless your doctor has given you fluid restrictions. Another key factor is ankle movement. In addition to heel raises, gently pointing and flexing your feet a few times a day keeps joints mobile and veins responsive. Even small movements add up. Let's address a common question. What if walking is painful or tiring? That's exactly when this exercise shines. Heel raises simulate part of the walking motion without the impact or balance demands. They help prepare your legs for walking and can gradually make walking easier again. However, it's important not to combine this with long periods of sitting without breaks. If you sit for more than an hour, try to do a few heel raises or ankle pumps before standing up. This reduces dizziness and helps blood return to the heart more smoothly. Now, let's talk about medications and medical conditions. Many seniors take blood pressure medications, diuretics, or medications that can affect circulation. This exercise is generally safe with these medications, but it does not replace them. Think of it as supporting your body's natural circulation system, not overriding medical care. If you have diabetes, this exercise is especially beneficial. Diabetes can damage blood vessels and nerves in the legs. Gentle, consistent calf activation helps maintain blood flow and supports nerve health. Just be sure to check your feet regularly for skin changes and wear proper footwear if standing. For those with varicose veins, heel raises help reduce pressure in the veins by improving upward blood flow. They may reduce discomfort and heaviness, though they will not make veins disappear. Compression stockings combined with this exercise can be particularly effective. Now let's clear up a dangerous myth. Many people believe that swelling means they should move less. In reality, safe movement is one of the best ways to reduce swelling. The body was designed to move blood through muscle action. Stillness allows fluid to pool. One more thing that often surprises people is how this exercise affects energy levels. When circulation improves, oxygen delivery improves. Many seniors report feeling less fatigued during the day after several weeks of consistent practice. This exercise also sends a powerful message to your brain. Your legs are capable. That confidence matters. Fear of movement leads to stiffness, weakness, and more circulation problems. Safe, controlled movement breaks that cycle. Now let's talk honestly about safety, because improving circulation should never come at the cost of risking your health. While this exercise is one of the safest tools we have for seniors, there are certain situations where extra caution is important, and a few warning signs you should never ignore. First, let's discuss when to slow down or modify. If you have significant arthritis in the ankles or feet, you may feel stiffness when you first begin. In that case, always start seated. Reduce the height of the heel lift. Even lifting the heels just a small amount can activate the calf muscles and improve circulation. Pain is not a requirement for progress. If you have neuropathy, especially common with diabetes, you may not feel the muscle work as clearly. That's okay. Focus on slow movement and good posture. Watch your feet as you move to help your brain stay connected to the motion. This visual feedback improves coordination and safety. If balance is a concern, do not rush to the standing version. There is no prize for standing. Seated heel raises provide powerful circulation benefits without fall risk. If you do stand, always hold on to something stable and keep your feet firmly planted. Now, there are a few conditions where you should talk to a healthcare professional before starting or continuing. If you have been diagnosed with severe peripheral artery disease, where blood flow to the legs is significantly blocked, exercise plans should be guided by a professional. Mild discomfort with walking is common in this condition, but sudden pain or color changes should be evaluated. If you notice one leg becoming much more swollen than the other, especially if it is warm, red, or painful, stop exercising and seek medical care immediately. These can be signs of a blood clot, and continuing to exercise could be dangerous. Also pay attention to skin changes. Improved circulation usually leads to healthier-looking skin. If you notice open sores, wounds that do not heal, or dark discoloration that worsens, medical evaluation is important. Now let's talk about how to gently progress without overdoing it. After a few weeks, your calves may feel stronger, and you may be tempted to add weight or do the exercise on stairs. For most people over 70, this is unnecessary. The goal is circulation, not muscle size. Body weight is enough. However, you can increase challenge safely by increasing control. Try holding the lifted position for 3 seconds instead of 2. Try slowing the lowering phase even more. These small changes increase muscle engagement without adding strain. Another safe progression is frequency, not intensity. Adding an extra short session during long sitting days can be very helpful. For example, a few minutes in the afternoon if you've been seated most of the day. It's also helpful to pair this exercise with simple habits that support circulation. Elevating your legs for 10 to 15 minutes in the evening helps reduce swelling. Just make sure your legs are supported comfortably and not higher than what feels natural for you. Avoid crossing your legs for long periods, as this can restrict blood flow. Choose loose-fitting socks and clothing around the calves and ankles. Temperature matters too. Cold causes blood vessels to constrict. Keeping your legs warm, especially in cooler environments, supports better circulation. This doesn't mean overheating, just comfortable warmth. Let's also address expectations. This exercise improves circulation gradually. It is not an instant fix, and results vary based on overall health, activity level, and consistency. The biggest improvements come from daily practice over months, not days. One of the most powerful effects of this habit is independence. When your legs feel stronger and more responsive, daily tasks feel less exhausting. Standing in the kitchen, walking through a store, or climbing a few steps becomes more manageable. Emotionally, this matters. Many seniors feel frustrated or worried when their legs don't cooperate. This simple daily action gives you control. You are actively supporting your health rather than waiting for problems to worsen. Finally, remember this. Aging does not mean circulation must decline rapidly. Muscles respond to use at any age. Blood vessels respond to movement at any age. The body is remarkably adaptable, even after Now, let's bring everything together, because understanding why this one exercise works is what helps people stick with it for the long run. At this stage, you're no longer just doing heel raises, you re-supporting one of the most important systems in your body. Leg circulation is not separate from overall health. When blood moves well through your legs, your heart works more efficiently. Oxygen reaches your muscles and nerves more easily. Waste products are cleared out faster. This is why something as small as a calf raise can have effects that go far beyond the ankles. Think about how often your legs are asked to support you every single day. Standing up, sitting down, walking to the bathroom at night, getting into a car. When circulation is poor, every one of these tasks feels harder, not because you're weak as a person, but because your tissues aren't getting what they need. This exercise quietly restores that support system. It reminds the calf muscles of their job. It reactivates the natural pump that aging and inactivity slowly shut down. And the best part is that it works with your body, not against it. One of the biggest mindset shifts I encourage in seniors is this. Don't wait for pain to move. Move to prevent pain. Poor circulation often doesn't scream at first, it whispers. By the time pain appears, problems are harder to reverse. This exercise is a way of listening early and responding gently. Another important point is consistency over motivation. Some days you won't feel like doing it. That's normal. On those days, do fewer repetitions. Do them seated. Do them slowly. Even 5 controlled lifts are better than none. The body responds to regular signals, not perfect routines. Over months, this habit becomes part of who you are. Just like brushing your teeth, it doesn't feel like exercise anymore. It feels like self-care. Many people tell me they start missing it on days they forget, because their legs feel heavier without it. Let's also talk about aging confidently. Many seniors are told, directly or indirectly, to be careful, don't strain, or just rest. While rest has its place. Too much caution leads to weakness, and weakness worsens circulation. Safe, controlled movement is not risky, it's protective. This single exercise also builds trust between you and your body. Each time you do it, you're proving to yourself that your legs still respond, still adapt, still improve. That confidence spills into other areas of life. You may find yourself walking a bit more, standing a bit longer, or worrying a bit less. It's important to remember that no exercise works in isolation. This movement supports circulation, but it works best when combined with simple daily choices: hydration, regular movement breaks, proper footwear, and listening to your body's signals. Together, these create a powerful foundation for leg health after 70. And here's something hopeful. Age does not shut down circulation benefits. Research consistently shows that older adults can improve blood flow and muscle function well into their 80s and beyond. The body doesn't need intensity, it needs consistency. If you've struggled with swollen ankles, cold feet, heaviness, or fear of falling, this is not a promise of overnight change. It's an invitation to steady improvement. Small daily actions compound into meaningful results. The surgeon's secret isn't a complicated device or an expensive treatment. It's understanding how the body was designed to move blood and using that knowledge in the simplest possible way. By choosing to do this one exercise, you're choosing to support your independence, your comfort, and your confidence. And that choice matters every single day after 70. If there's one thing I want you to remember from today, it's this. Your legs are not failing you, they're just asking to be used in the right way. Poor circulation after 70 is incredibly common, but it's not something you have to silently accept. Your body still has the ability to respond, adapt, and improve when you give it the right signal. That one simple heel raise movement may look small, but inside your legs, it's doing important work. It's waking up the calf muscles, pushing blood upward, feeding your nerves, and reducing the pooling that leads to swelling, heaviness, and discomfort. And it does all of this without stressing your joints, without risking falls, and without requiring special equipment. You don't need to do everything at once. Start where you are, seated or standing, 5 minutes in the morning, 5 minutes later in the day. Let it become part of your routine, not another chore. Over time, those small moments of movement can add up to warmer feet, lighter legs, steadier steps, and more confidence in your daily life. Most importantly, don't underestimate what gentle consistency can do. Aging does not mean giving up, it means being smarter about how you care for your body. This exercise is not about pushing harder. It's about supporting your circulation, protecting your independence, and giving your legs the attention they deserve. Your future comfort starts with what you do today. Move a little, breathe a little, and trust that your body is still capable of positive change at any age.